We are going to see about the bar class. So bar class, it is also known as the gingivally approaching class or roach class or vertical projection class. So this clasp of retainer which bar type of extended from major connector or from within the denture base, it arms passes adjacent to the soft tissue and approaches a point of contact on the tooth in the gingivo-occlusal direction. So the design features which bar clasp consists or I bar clasp consists approaches the undercut area or the retentive area from the gingival direction, which is not opposing from the occlusal direction. So it will approach from the underway in opposite direction from the gingival part. So this is a push type of retention is there. Flexible minor connector, which is called as approach arm, should be so strong to be rigid and to enough to support the structures. And the tissue side of the arm should be smooth and polished because it contacts the mucous area. So if it is rough, it will produce any irritation towards the tissue area. So it should be biocompatible and it should be soft. Approach arm tapers uniformly from the attachment to the clasp terminal and it never bridges the soft tissue undercut as there can be a chance of foot lodgement. So it is placed as low as possible on the tooth surface and the clasp terminal should engage within the distal undercut. So the type of bar clasp between use as T clasp, modified T clasp. So T clasp this because the arm resembles the T shape and it has a non-retentive area is above the height of contour. Whereas the modified T clasp, the non-retentive terminal is above the height of contour, but it is aesthetically preferred, whereas there will be a compromise in stability. Next is a Y clasp, which is considered like the T clasp, same as a T clasp, but the height of contour is located high in the mesial and distal surface, and the center area is low or deep. So it will have a depth and curvature in the center of the clasp arm. Next is an I clasp, which is placed on the distobuccal surface of the maxillary canine. The tip contacts just 2 to 3 mm to the gingiva, but there is a compromise in the stability. Next is an I bar, which is a modification of the I clasp, so has a mesial rest and I bar for vertical support and for horizontal stability, though the contact should be at a passive area. So indications of the I bar such as the smaller undercuts in the cervical third, in tooth supported with partial denture or distal extension cases, the areas where the contraindicated such as deep undercuts or soft tissue undercuts, if the retention and the undercut area is away from the edentulous area. So the advantages of this I bar system is the push type of retention, easier for the patient to insert, aesthetically superior and less prone to the caries. The drawbacks which are followed such as tendency of foot lodgement, cannot be used in the shallow vestibule and it cannot be used in extensive undercuts, lingual or buccal or in the abutment of the teeth. Thank you.